Hello and welcome to the HeartFit Clinic. My name is Diamond Fernandez. I'm your founder and director of the HeartFit Clinic. And today I want to talk to you about preventing a heart attack or stroke, whether it be your first one or second or third one, whatever it might be. So our focus at the HeartFit Clinic is really focusing on doing some really great assessments to see where your risk is of heart disease, whether it be and there are very different forms of heart disease. When we look at heart disease, there are a few things that we can focus on. One that we always talk about is artery disease. That's blockages that can end up happening. You can also have structural disease where the heart structure is not working like it's supposed to. You could have valve disease. You could have what we call arrhythmias, which are funny or dysrhythmias, which it can be different things that you have an abnormal heart rhythm of some sort, or you could have some kind of cardiomyopathy or heart failure or anything from that aspect of it. So when we talk about heart disease, those are some things that can happen that we want to prevent, right? We want to prevent, usually a heart attack or stroke is the number one thing that people want to look at preventing. So when we look at that part of it, what we focus on the HeartFit Clinic and how we differ than doctors and whatnot, we've got a lot of videos on that part of it, but our focus is on really providing you some screening tests to see where your risk is of a heart attack or stroke before it shows up on diagnostic tests if you were to go see a cardiologist or whatnot. So our focus with the HeartFit Clinic is really to focus on assessments to see where your risk is. So one of the first assessments that we look at is looking at the artery health. The artery health is to kind of look at how is the health of the arterial wall. We go inside right with ultrasound, we see what is the thickness of that arterial wall, and we give you an age of the arterial wall, which is a really cool test to get done. Another is that your arteries are, it's a muscle. It's not a pipe. And many times we think of it as a pipe, like, I got to make sure that that kitchen sink doesn't overflow or get blocked. Your pipes, your arteries are different than a pipe, than a kitchen sink. And so what we look at is artery function. And so there's a test that we look at, it's called an endothelial function assessment, but it's a test that we look at how is the function of the arteries. Your arteries should be like a garden hose that you bought from your local hardware store, not something that has been left out all winter long. So that's something that's very important that we look at. We also have the ability to do particle size cholesterol testing. And I got some explanations below there, but particle testing is looking at the size of the cholesterol, because size matters. Going to your doctor or your cardiologist and looking at your cholesterol, it's very important to look at that, but size matters. Sometimes you're being prescribed a cholesterol-lowering drug when maybe you don't necessarily need it. Or sometimes you should be prescribed something or get focused a little bit more aggressively on something because it's all matters about the particle size. Okay, so that's something else that we do. We also look at some key inflammation markers for heart disease, because heart disease is an inflammatory disease. And when you look at that part of it, it's important to look at what's causing, cholesterol. We think that cholesterol is really the main concern of things, but if you end up with cuts inside your arterial wall, what is causing those cuts? What are the inflammation markers that are important? So we look at that part of it. We also do, because we feel that exercise is the best medicine for you, so we do a clinical fitness assessment with you where we look at your ECG, we look at your blood pressure, your heart rate, your oxygen levels, and find a safe level for you to be exercising at, because exercise is the best medicine, so we do a test like that. We also have the ability to look at micronutrient deficiencies. So when you look at micronutrient deficiencies, there are so many reasons as to why people end up with heart disease, whether it be toxins or deficiencies in their blood. And if you continue down that path, all of a sudden you end up with bad cholesterol, you end up with blood pressure issues, or you can't sleep at night, and it's because you have some deficiencies that are not been looked at or taken care of. We also have the ability to look at hormone dysfunction. So, that's also another area that we can focus on, but really where we focus on treatment option of it, that's where we look at our ECP therapy or lifestyle changes to kind of help you, obviously choosing proper supplements and nutrition to kind of focus on to prevent and reverse heart disease. So this is what we focus on to prevent a heart attack or stroke, is really looking at your artery health, your function, looking at some particle testing, looking at your metabolic risk with that part of it, looking at inflammation disease, doing a clinical fitness assessment to see where you're at, looking at micronutrient deficiencies, hormone deficiencies. We also have the ability to look at genetic disorders as well. So again, if you have any questions, comments, or observations, we welcome them. We look forward to helping you live happier, healthier, and longer.